Hello, my name is Cary Love, and today I'll be talking to you about the Marion County Needs Assessment and why I've asked you to join our steering committee. We will be going over the definition of needs assessment, the role of the steering committee, the MAP process, how we plan to collect information for the assessment, and what we have found through our community health status assessment. The purpose of our needs assessment is to uncover health needs and issues that exist in Marion County. This assessment will also help us to identify strengths and resources available in the community and eventually use this information to create goals and priorities to better the health of Marion County. There are many benefits to conducting a needs assessment in Marion County. First, it allows us a better understanding of the community and its current needs. Second, it provides us with insight from community members themselves. Third, it has the potential to tap into current resources in the community that may be underutilized. Fourth, it can garner collaboration among community organizations that leads to improved health resources. These are only a few examples, and others are realized throughout the needs assessment. You have been invited to join the steering committee because you have already shown that you are a vital part of Marion County and can offer insight on what the gaps, needs, and current resources of the community are. The steering committee will guide and oversee the community health assessment, which we will discuss shortly. Each of you offers a unique perspective and together represent the community and local public health system. Through this process, you will help to prioritize the factors most vital to improving the health of Marion County. While you have already shown to offer beneficial and necessary services to our community that have improved the lives of the people who call Marion County home, becoming a part of our steering committee offers an additional opportunity to improve your community's public health. Mobilizing for action through planning and partnerships, otherwise known as MAP, will be used for the Marion County Needs Assessment. This community-driven, strategic planning process aims to prioritize public health issues, identify resources to address those issues, and set a plan using the identified resources. This interactive process uses 4 assessments: the Community Themes and Strengths Assessment, the Local Public Health System Assessment, Community Health Status Assessment, and finally the Forces of Change Assessment. We will discuss each assessment in the following slides. The Community Health Status Assessment looks at how healthy the community is and what the current health status of the community is. To answer these questions, we will look at 11 key indicators: demographics, socioeconomic characteristics, health resources in the community, quality of life, behavioral risk factors, environmental health, social and mental health, maternal and child health, death, illness, and injury, infectious disease, and sentinel events. To collect information on these indicators, we will be utilizing several different sources, including Florida Charts and the Community Commons. As the steering committee, you will be overseeing a subcommittee that will be responsible for conducting the community health assessment. You will be identifying data sources for the subcommittee, helping to select the most important indicators, and offering input as needed. After collecting the information, our MAP core group will conduct an analysis and then present the community health profile to the community. After the assessment, we will continue to monitor these indicators over time to track any progress. The Community Themes and Strengths Assessment considers what is important to Marion County, how quality of life is perceived, and what assets are currently available to improve the community's health. For our needs assessment, we will gather information through surveys and key informant interviews. The steering committee will use a subcommittee to promote the awareness of the survey within Marion County. The survey will be distributed at local churches and within major employers. Flyers will also be posted at local businesses, such as coffee shops, with a link for residents to complete the survey online and a contact email address if they wish to have a survey mailed to them. Finally, the survey link will be posted across social media, including the Florida Department of Health's Facebook page. Efforts will be taken to include a diverse audience of multiple races, ages, socioeconomic statuses, and education levels by distributing the survey throughout each town and the city of Marion County and using multiple platforms to distribute the survey. The survey will be available both online and in print version. Both versions will be available in Spanish. Before distributing the survey, the subcommittee will utilize a small group of volunteer community members to provide input on the survey. The steering committee will first assist in developing the questions for the key informant interviews. They will also be responsible for identifying who the key informants are. They will then oversee the subcommittee in collecting and analyzing the data from the key informant interviews. The steering committee will help to identify the key informants by researching the most prevalent and involved organizations in the community, as well as utilizing their relationships with community representatives. The interviews will be conducted in person by members of the subcommittee. However, if the key informant is not able to meet in person due to limitations in their schedule, a Skype interview will be offered as an alternative. The interview will last no longer than 1 hour. The Forces of Change assessment considers forces, including legislation and technology, that affect how Marion County operates. It answers the questions: what is occurring or might occur that affects the health of the community or the local public health system, and what specific threats or opportunities are generated by these occurrences. Forces include trends, which are patterns over time, factors, which are elements such as the community's geographic location, and events, which are one-time occurrences such as a natural disaster. The steering committee will be responsible for participating in the assessment and identifying opportunities and threats for each force. The MAP core group will then summarize and compile the results from the assessment. The assessment will take place at the local community center, and the facilitator will be a member of the steering committee. A brainstorming worksheet will be utilized to identify the forces of change by asking several questions, such as what forces are occurring locally and nationally, and what trends are occurring and what impact do they have. For each question, we will consider the social, economic, political, technological, environmental, scientific, legal, and ethical categories. The Local Public Health Systems Assessment considers all of the organizations and entities in Marion County that contribute to the community's public health. It answers the questions: what are the components, activities, competencies, and capacities of our local public health system, and how are the essential services being provided to Marion County? The 10 essential public health services are listed on the next slide, although I will not go into them in detail. The public health system consists of a plethora of partners, including the public health department, the media, neighborhood organizations, churches, community centers, and much more. For this assessment, a subcommittee will be created to engage the community to participate, prepare for activities, facilitate the assessment using the National Public Health Performance Standards Local Assessment Facilitator Guide, and record the results. The steering committee will oversee the subcommittee, participate in the assessment, and discuss the results to identify challenges and opportunities. The assessment will take place over 2 days. The first day will cover essential services 1 through 5, and the second day will cover essential services 6 through 10. There will be breakout sessions, and then the group will come back together to review. These are the 10 essential public health services. We have begun to collect data for the Community Health Status Assessment, which I would now like to share with you. So far, we have looked at the demographic structure of Marion County, social and economic factors, the physical environment, clinical care, health outcomes, and health behaviors. While there is more work to be done to get a full picture of the public health of Marion County, your feedback is important to our needs assessment. First, looking at the demographic structure of Marion County, we can see that we have a large elderly population which will require a greater need for healthcare resources in the community. 28% of the population is 65 years old and older, compared to 14% nationally. In addition, there is a large percentage of veterans in Marion County compared to in the United States. Veterans may have specific health issues such as post-traumatic stress disorder or disabilities that will require additional physical and mental health services. When looking at social and economic factors, we can see that there are several disparities in Marion County. The median family income is only $48,000 compared to the national median outcome of $66,000. Additionally, 18% of residents, including 31% of children, are living below the federal poverty level, both higher percentages than in the United States as a whole. Poverty can lead to health disparities as people living in poverty have fewer health resources, including insurance. Looking at social factors, we see that while there is a high percentage of Marion County residents who have their high school diploma than nationally, the percentage of those who have their bachelor's degree is much lower. Higher education may lead to more health resources and knowledge of healthy behaviors. In addition, the rate of violent crime is higher in Marion County than in the United States, with 441 violent crime offenses reported by law enforcement per 100,000 residents in Marion County, and 379 per 100,000 in the U.S. Violent crimes such as domestic violence will require additional healthcare resources. Access to clinical care is unfortunately lacking in Marion County. The rates of primary care physicians, dentists, and mental health providers all fall below the national levels. Marion County has 15 designated health professional shortage areas, or HPSAS, which are defined as lacking primary medical care, dental, or mental health care providers. 100% of the population in Marion County is living in an HPSA. There is also a high number of preventable hospitalizations for people under the age of 65 in Marion County, indicating a need for greater access to primary care. In 2016, there were 2,842 preventable hospitalizations for people under the age of 65, a rate of 1,142 preventable hospitalizations per 100,000 residents. There are several health outcomes in Marion County that should be considered during our needs assessment. These health outcomes can lead to negative health impacts for residents and the community as a whole. Of specific concern are Marion County's rates of heart disease, cervical cancer, lung cancer, and prostate cancer, as they are much higher than the national rates. The top 10 causes of death in Marion County are heart disease, cancer, unintentional injury, chronic lower respiratory disease, Alzheimer's disease, stroke, diabetes, chronic liver disease and cirrhosis, hypertension, and suicide. These causes should also be addressed in the needs assessment in order to look for prevention methods to lower their rates in the community. Individual health behaviors, including nutrition, exercise, and substance abuse, have numerous effects on the community's health status. In particular, Marion County has higher rates of self-reported cigarette smoking than in the United States, with 24% reporting smoking compared to 18% nationally. Smoking can lead to negative health outcomes, including cancer and cardiovascular disease. In addition, physical inactivity is more common in the Marion County than in Florida and the rest of the country. 27% of Marion County residents age 20 and older self-report no leisure time physical activity compared to 22% in the United States. Unfortunately, the percent of adults over the age of 18 who have inadequate fruit and vegetable consumption is also higher in Marion County at 78% compared to 75% nationally. This concludes our presentation. If you have any further questions about the purpose of the needs assessment, your role, or the data we've collected thus far, please feel free to ask any questions. My contact information is listed here. You will receive an email shortly on our next meeting where we will begin to plan for the community themes and strengths assessment. I appreciate your time and look forward to working together to better the health of Marion County.